Chemotherapy works by killing cancer cells or stopping them from growing. It can also affect other cells in the body and can cause side effects. There are many chemotherapy treatments, and each one can have different side effects. This film explains some of the more common ones. It is important to also read the information you have been given about the treatment you are receiving. You may not receive any or all of the side effects that can occur. Some people only have mild side effects, and others can have more serious and severe ones. This is shown by the use of the different colours in this film. Green is mild, red is severe and serious, and orange is between mild and severe. If you need to ring the advice line, the number is on your alert card and on your patient information. White blood cells play a vital role in fighting infection. Chemotherapy can lower the amount of white blood cells in your body, which can increase your risk of infection and make you less able to fight it. This can make you at risk of life-threatening sepsis. The signs of infection to look out for are a temperature above 37.5 or below 36.0, flu-like symptoms, feeling cold and shivery, sore throat, new cough, and pain on passing urine. Some patients say they just feel generally unwell and poorly. You will need to have a thermometer so you can check your temperature. Please do this at least once a day whilst on treatment. Try to avoid taking paracetamol or anti-inflammatory medication, such as ibuprofen, before you take your temperature, as this can hide this symptom. It is important to ring the helpline if you have a temperature above 37.5 or if you have symptoms that could be an infection. Platelets are blood cells that help the blood clot and help to stop bleeding. Chemotherapy can reduce the number of platelets in your blood. Look out for a large area of bruising, or bruising where you did not have it before, or bleeding that does not stop within a few minutes. This includes nosebleeds, bleeding gums, blood when you go to the toilet, in your urine or stool. Also, keep an eye out for a rash with purple spots on the skin, which can be a sign of small bleeds under your skin. Ring for advice if you have any of these symptoms. People with cancer have an increased risk of developing blood clots, such as deep vein thrombosis and pulmonary embolism. The symptoms include pain, redness and swelling in one arm or leg. They can cause increased shortness of breath. Contact us immediately if you develop any of these symptoms. Sometimes chemotherapy can cause diarrhea. If this is a side effect of your treatment, you will have been given anti-diarrhea tablets to take home. It is important to take these if you have diarrhea. Follow the instructions on the packet. If you are not sure how to take them, please ring for advice. You should also drink plenty of fluids to replace the water lost with diarrhea. Aim for at least 8 cups a day. Diarrhea can lead to dehydration, which can be very serious if it is not treated. Signs of dehydration include feeling faint or dizzy, feeling thirsty, passing urine less often, or having dark-coloured urine. Please ring if you have any of these symptoms. Diarrhea can be a sign of infection, so keep checking your temperature and ring for advice if you feel unwell. Constipation is also a common side effect of chemotherapy, as some chemotherapy drugs, anti-sickness medication, and painkillers can cause constipation. What you can do to help is drink plenty of fluids, eat more fibre, fruit, whole grain cereals and vegetables. Gentle exercise can help. You can also take a mild laxative which you can get from your GP or pharmacist. If you want advice on laxatives, you have not had a bowel movement for 3 to 4 days, or have abdominal pain or vomiting, call the advice line. Sometimes chemotherapy can make people feel sick. If this stops you from eating or drinking, you are very sick, you can become dehydrated. There are lots of different anti-sickness medicines. It is important to tell us if you are feeling or being sick so that we can find the right anti-sickness tablets that work for you. Please see our film Living Well on Treatment for advice on eating and drinking on chemotherapy. Sometimes chemotherapy can cause your mouth and gums to become sore. This can stop you from eating and drinking, and you can become dehydrated and lose weight. This can be serious if not treated. Follow the advice in the leaflet Caring for Your Mouth. Brush your teeth twice a day using a toothbrush and fluoride toothpaste. Rinse your mouth with water after every meal to wash away any food particles. Check your mouth daily for ulcers, white spots, cracked lips, and a coated tongue, which can be signs that you have a problem. You should avoid dental treatment while on chemotherapy. Please talk to one of the chemotherapy team for advice. Fatigue is a very common side effect of chemotherapy, experienced by most patients. It can have an impact on the physical activity, emotions, work and social life, and coping with treatment. Our film, Living with Cancer Treatment, contains advice on managing fatigue during treatment. Please take a look. Some chemotherapy drugs can cause hair loss. If this can happen with your treatment, this will be explained to you. Talk to the nurses on the chemotherapy unit for more information. Hair thinning can also occur. Use gentle hair products, such as baby shampoos. Do not use colours or have a perm. Use a soft brush. Keep your head out of the sun. Don't use anti-dandruff shampoos. Sometimes people become seriously unwell and need to call for specialist help provided by accident and emergency services. This may be due to your cancer treatment, but can also be caused by other health problems, such as heart attack, sepsis, or stroke. Signs of this include slurred speech, confusion, change in the level of consciousness, passing no urine in a day, severe breathlessness, skin that is mottled or discoloured, and chest pain. If you become seriously unwell, ring 999. Do not call the assessment unit, as you could be using valuable time. Show your alert card so the emergency teams know that you are on cancer treatment. There is plenty of information and advice available, and our staff has been specially trained in providing care for patients who are receiving chemotherapy. There are also good sources of advice available in written leaflets and videos on established websites and charities. These include Macmillan Cancer Care and Cancer Research UK. Please ask the nurses, doctors and pharmacists who provide your cancer treatment for more information if you have any questions. Some people have a combination of treatment, and you may have immunotherapy as well as chemotherapy. We also have a film about immunotherapy. Please watch this if you are having both types of treatment. If you are not sure, please ask one of the nurses.